My name is Stephen Boyne. I am going to be presenting today the Maximizing COVID-19 Government Support Dollars. I'm an attorney with the law firm with the Florida healthcare law firm based out of Delray. See, we have quite a few people logged in, and feel free to ask any questions online if you have any as we go along. What I'll probably do is handle them at the end of the presentation. This is really going to be somewhat of a high-level overview of the dollars that are currently available to various healthcare entities around the nation. I'm going to touch on some other sources of money which come from state governments, federal governments, not-for-profit organizations, and other non-healthcare providers. Okay. I appreciate you all logging in, and I hope I'll be able to help you out. As we all know, COVID-19 has really devastated the U.S. economy and probably will change the economy for at least the foreseeable future, whether that's months or years. My gut feeling is that the U.S. economy is going to change. There's going to be substantial changes in the U.S. economy overall. I think there's going to be substantial changes to the healthcare sector as well. What those changes are, I really can't foresee. I can sort of take a guess at a few items, but I think right now we're just sort of living day to day, and we're trying to get through this pandemic. The federal government and most states' responses to this, beyond struggling with coming up with rules and regulations for closing down the economy and now opening up the economy, is to really throw a significant amount of money at this problem. And it's probably the right thing to do when you look back at the way the government's handled previous either pandemics or major shocks to the economy, throwing money at this and trying to guide, not necessarily picking winners and losers, but just trying to guide the economy back on its legs again. I think you'll find that part of the money that's available is a little bit of a luck of the draw in that some people were able to get money earlier than others. Others have been denied money for what seems to be no good reason. It's a little bit luck. It's also timing, and it's also specifically with the Paycheck Protection Act, which financial institution are you working with? Some smaller entities, financial institutions, have processed Paycheck Protection Act applications very quickly. Others, such as Wells Fargo and Bank of America, have taken a significant amount of time to process the payments. Nevertheless, from what I'm seeing with my practice, the money is beginning to flow, and I also think there's a lot of other additional opportunities available for money beyond what we're going to, the sort of PPP that everyone knows a significant amount about. The first major act that was passed by Congress is the CARES Act, and it sort of included a lot of different sources of funding. The initial one was the Emergency Economic Injury Disaster Loan. Basically, it was a loan that really sort of has morphed into more of a grant for $10,000. It's administered by the SBA. I've heard from various clients, some who've been have filled out their applications with the SBA and got money back very quickly. Others filled them out 6-8 weeks ago, didn't get the money. I can't see a rhyme or reason to it. It may be geographic in nature. in that I've seen certain parts of Florida and certain parts of New York have received money very quickly. Other parts of Florida haven't yet to see it, or they've received denial letters that don't seem to make sense. Again, there's not a lot of rhyme or reason to the emergency economic injury disaster loan. The um, the good news is that if you get the money, it becomes, in effect, a grant, assuming you're using the money for basically legitimate business purposes, such as payroll and supporting your business. And you will be entitled to up to basically a maximum of $1,000 per employee. And independent contractors and also corporations are entitled to this source of money. But given the nature and the scale of the shock to the economy and the healthcare industry in general, this $10,000 or $1,000 per employee is not going to necessarily help us get through this pandemic. The Paycheck Protection Program, as probably many of you know, is basically essentially a grant from the federal government. It covers payroll, employee benefits, rent, mortgage, utilities for 8 weeks, aimed at quote unquote small businesses. It's managed through the banks and private financial institutions. I think it's very important that everyone recognizes that basically your application went through to the bank, and the paperwork, if you are able to receive the money under the PPP, the paperwork will be submitted back to the banks. So you're not going to have federal agents, federal employees initially looking at the paperwork that you submit. You're going to have bank employees who are frankly not that. They may be familiar with their internal lending policies and procedures, but they may not be familiar with, in effect, handling a government grant. Probably the most, if you can just, one item, probably the most important item to take away from today's discussion is you need to document you need to have a copy of obviously your application, copy of your notification that you've received the money, keep track of the timing of when you received it, and keep very, very detailed paperwork, because you're going to be submitting that paperwork to bank employees who will be overseen by federal employees. And each bank is going to be different. Each employee at these banks are going to probably have slightly different rules and regulations for reviewing your documentation. So frankly, the more paperwork, the better. You can, these are the tips apply. And if you haven't received it from one, if you're still waiting on the money and you haven't received the money for the PPP, apply through multiple financial institutions, because basically whoever funds it first, well, there is a sort of a number used by the federal government for tracking this. So there's no downside for applying to multiple financial institutions, because whoever comes in first, when you accept it, in effect, like basically locks out any other financial institution from administering the grant. Again, keep excellent records. You can only use the money for W-2 employees, not any 1099 contractors. And the reason for that is because 1099 contractors are actually able to apply for their own PPP. So you want to, the federal government doesn't want you to double dip. One other item that I think is important, probably most of you are aware, but you cannot, as of today, or at least as of about a week ago when the most recent regulations were promulgated, you cannot, if you receive the money from the federal government and you utilize it to pay your employees, you cannot turn around and deduct the, in your normal course of business, the salary that you paid that employee, because the money that you've received from the federal government is not taxable. Therefore, since it's not taxable, you can't deduct the payment to your employees as a business expense. Otherwise, in effect, you would be double dipping. Now, there is some conversations going on within Congress now, because apparently some members of Congress wanted basically a double benefit to for employers. But as of now, you should not deduct that payment, and I would assume your tax professional, your CPA, or whoever you work with is probably aware of that, but just make sure that you do not deduct that. The rules are relatively strict. Basically, what they do is you look at the number of employees you had on February the 15th, and you in effect cannot go out and hire more employees than you had on February the 15th, but they don't have to be the same employees. So to the extent that you had 10 employees on February the 15th and now you only have 9 and 3 of the people quit and you've hired 3 people, you can use the PPP for those 3 new employees. You just basically can't go over the original 10 that you had in place. If you have to use to basically to turn this Paycheck Protection Act, the PPP loan, into a grant, you have to obviously have used it for your employees and all of their benefits, and also you have to have used it for utilities and some other items that I'll touch on in a few minutes. And if you basically are only able to use, say, 80% of that money, or 90%, or 50%, whatever it is, you either have to pay it back, or you can in effect borrow the money at 1% interest, and you have a 2-year time frame to pay it back. So in this economy, with a lot of companies struggling for money, I would advise people to probably not pay it back initially in a lump sum and pay it back over time with a 1% interest, because in today's economy, 1% interest isn't too bad. If you have a prior SBA loan that was delinquent, you cannot, you will not be entitled to receive the money. You can use it for, in addition to salaries, you can use it for group healthcare payments, premiums. You can also use it to pay for the payment of any state or local taxes, to the extent that you're in a state that has income tax on employee salary. You can use it for that as well. The CARES Act also provides additional funding for folks who provide services in the Medicare and Medicaid space. Hospitals specifically are entitled to 6 months of advanced lump sum payments based on their past Medicare billings. The HHS has issued a significant number of grants to healthcare providers, and those of you who have received that, you will probably see, at least in Florida, it would say something HHS United, because I believe United Healthcare was the entity that handled the payments. That is not income to you. At least I believe it's not income to you. That's what I've been told by healthcare professionals. Tax professionals. But you need to double check on that. It's definitely, it is a grant. It's not a loan. You do not have to pay it back. And it was done based on a calculation of 2019 Medicare fee-for-service reimbursements. Now, one point that's important is that there is an attestation that you have to sign within 45 days of receiving the funds. The HHS has a specific location on their website where you should go to, and a lot of folks sort of woke up one morning and saw there was, physicians. I know some physicians who woke up one morning and saw $20,000-$30,000 because they had a pretty big Medicare practice, or $20,000 or $30,000 sitting in their bank account. They figured it out pretty quickly what it was. They recognized it was a grant, but they may not recognize that you actually have to sign an attestation saying that you've received the funds and that you're going to agree to utilize the funds, in effect, basically, to support your practice. Skilled nursing facilities, dentists, and other providers that treat Medicare beneficiaries are also entitled to additional assistance. and the HHS has a portal available for specifically for nursing facilities, dentists, and other providers, especially those that provide Medicaid um, services um, services to folks who are insured through Medicaid, to basically apply um, for funding and grants. Finally, to the extent that a healthcare provider, either hospital, physician, a dentist, or anyone else who has provided any care to uninsured folks who may have had some sort of COVID-19 condition, they're entitled to a grant. I mean, to a reimbursement for their fees that would that perhaps they would have written off in the past. Rural providers, there are numerous uh, sources of funding for a rural provider. And one of the first questions that comes up is, how do you define what is a rural provider? The HHS has a website where you can actually go in, punch in your address, and determine whether or not you're a rural provider. So, for example, if you look in Nassau County, which is in the northeast corner of Florida, uh, portions of it are rural and portions of it are not. And to the extent that you're a physician or a healthcare provider whose address happens to be within a certain specific zip code, there are many different additional sources of grants and funding available to you that comes under the CARES Act. To the extent that any healthcare providers has provided any assistance to any patients, and this really is primarily aimed at hospitals or clinics, larger clinics, but basically, if you provided care to COVID-19 patients, there are assistance and grants available for the purchase of PPE, contact tracing, infection control, mitigation, prescription costs, and even the temporary construction of facilities that you've seen outside some of the hospitals. The federal government will reimburse those healthcare providers. There are additional items that I have not included on this. Did some additional research over the past 48 hours because this really is changing a lot. But to the extent that you provide substance abuse or mental health services, there's available grants and funding. To the extent that you provide any suicide prevention services, there are available grants. If to the extent that you provide nutrition programs, there are available grants. To the extent that you're a nursing home and you have to obviously have some sort of infection control, there are available grants. Additionally, the federal government has reversed some of the unrelated Medicare and Medicaid cuts that some of you folks have seen, the 2% cuts based on inability to do this or to do that, or you didn't upgrade your system to electronic health records and all those kind of things. That's a lot of that's being rolled back, and the Center for Medicare, CMS has been sort of tasked with going back and changing those. I'm not so sure whether you will initially see that, but at some point within the next year or two, you're actually going to see a rollback of some of those cuts. Again, the idea is to not only provide sources of money to healthcare providers who are providing care to COVID-19 patients, but also just provide health funding for healthcare entities in general throughout the United States. Again, the factors pertaining to go back to the PPP, in addition to assistance with payroll, you get tax credits for sick leave for anyone who may have come down with COVID-19, or they have to provide care to other people who have COVID-19. There's tax credits available. There's tax credits for available for employees who request leave for childcare. There's a payroll tax deferred for payments for any payments that due in 2020, and there's also employee retention tax credits. So to the extent you keep employees on, there are some tax credits available as well. So it's pretty broad, it's pretty detailed, and it probably is beyond the scope of today's presentation to go through all of the items, but there's a lot out there if you know where to look and how to apply for it. And there's also timing issues associated with applications, especially for grants and those other items. Other types of relief. State and local assistance, there are literally hundreds of grants and emergency loans based from states, counties, and cities. FEMA has programs available mainly aimed at states and tribes, but to the extent that you are not-for-profit institution, there are grants and programs available through FEMA as well. And states and local assistance, if you just need to go sort of dig around. There are certain websites that you can go look for. There are certain places that we can guide you to come up with to submit for grants or assistance. But many small and mid-sized counties, cities around the nation have come up with relatively small amounts of money, but sometimes larger amounts of money, primarily aimed at healthcare providers and other small businesses to help them through this. So don't just focus on the PPP and the emergency loans from the federal government and perhaps other loans from the SBA. You need to begin to look a lot broader because there is a lot of money out there if you just know where to look. Telehealth. This is an area that probably is perhaps the only silver lining in this cloud, and trust me, it doesn't offset all of the other problems. But telehealth, as many of you know, really has substantially grown. There are a lot of the federal government in many states have waived. The federal government especially has waived a lot of the frankly onerous regulations pertaining to telehealth. And as a result, the U.S. has seen a substantial adoption of telehealth. And the regulations that have been loosened, many of them will probably be permanent because a lot of people are getting used to using telehealth, both from a provider perspective and a patient perspective. And there are a significant number of grants available to healthcare providers who are in the process of either upgrading their systems, purchasing new systems, or even utilizing their current systems. There's grants available for equipment purchase, networking facility upgrades. There are including payment to go from 25 megabit to 100 megabits. So whatever you need to do, there's a lot of money out there for telehealth assistance, buying the right equipment, upgrading your systems, and those kind of things. And the assistance available is through the federal government, the states, and also a lot of charitable organizations have set up abilities to fill out applications for grants and those kind of items. So to the extent that you either currently utilize telehealth, are thinking about using telehealth, or have just started to use it and learning how to use it, there is a lot of money to be had in that area. And ultimately, as we see the healthcare industry moving a lot, I guess embracing telehealth a lot more on a much broader scale, to the extent that that your practice allows you to do this, you'd be foolish not to tap these sources of fundings, because within a year or two, the funding will be gone, and then everyone's going to expect telehealth. So to the extent that you can get assistance, I would strongly suggest you apply for it. Again, the whole definition of rural is very is pretty clear. But if you happen to live in a rural area, the FCC, for example, has money available for telehealth. The FCC will provide equipment. I mean, money to purchase equipment to assist in perhaps paying for your internet connections. The USDA, interestingly enough, has money available, again, primarily towards underserved or rural areas. The Health Resource and Service Administration, which is really sort of aimed at providing assistance to rural areas in the healthcare, they have money. The Universal Service Administration has money. The NIH has money. There is a lot of money to be had if you happen to live in a rural area. But even if you don't live in a rural area, there is a smaller pot of money, but there still is money available to be had in that area. So again, to the extent you're moving towards implementing or you currently implement telehealth, offer telehealth, that's something that you really ought to be focusing on. There's been some most recent updates to the PPP that some people are aware of and some people are not aware of. The application, and this, I believe it was about 7 days ago. It could have been a little bit longer, but basically the application for the PPP was updated. Now, those of you who have already applied for the PPP and even received your money, I strongly suggest you go back and download the most recent application, because the most recent application has a lot of clarification in that with respect to definition issues, and I'll explain what that is, but you need to download it and get a copy of it and read it, because that application is the one you're actually going to be held to. So, for example, the first application, you had to provide or at least certify that you had a proof of hardship. There is no requirement of that. The original application basically talked about how you have to when you have to start paying your employees is on the day. When does the 8-week period start? Does it start on the day that you actually receive the money, or does it start on the next day when you pay your employees? Again, they've updated this application to give flexibility to employers when they start their 8-week period. So you're going to be held to that. They have expanded the definition of rent. Most people thought rent was sort of the rent of real property, i.e. your office building. It now includes such items as rent on equipment leases and other leases of personal property. So, computers, copiers, fax machines, credit card machines, all of that kind of stuff that you lease is now rent. So that can now be paid through whatever funds you've received from the PPP. Other interest on any, and it doesn't even define what a debt obligation is, but to the extent that you owe money or your practice owes money to a third party, the interest on that for at least the 8-week period is deductible. I mean, the money you're able to use the money for that debt obligation. It sort of expands the definition of utilities to include obviously electricity, gas, water, but now it expands transportation. Transportation is sort of a strange one. It's undefined. I frankly, there's a lot of talk about what does that mean. I am not sure exactly what it means, but I will touch on. I think it probably means what your employees perhaps may pay to come to work, or perhaps I don't really know what it means. I'm not so sure anyone, even the federal government, knows what it means. It includes telephones and also internet access. And telephones, I would include both landlines and cell phones. Now, obviously they've clarified some items, but they've also left other items out. In other words, what is a debt obligation? What is transportation? Again, these are unclear, but probably at this point, I would work with my tax professional, whoever does my taxes and applications, that I would take for want of a better term, an aggressive position on this, because I think, again, you're not going to have folks from the federal government reviewing these items. You're going to have bank employees and bank folks reviewing the paperwork that you submit. To the extent that they deny a transportation fee or expense, then fine, they've denied it. I think you're in a pretty strong position. I don't think you're committing fraud or anything else because it's undefined what transportation is. So take an aggressive position, see where it goes from there. Perhaps there'll be some additional items or clarifications that come out over the next few weeks. Also, I forgot to mention earlier that to the extent that you have not applied, you've given up applying for the PPP, please don't. There's about 120, $130 billion still available. So, get your application in if you haven't already applied for it. And also, if you have applied for it and haven't heard, fill out a second application because the money is there. It can really benefit small and mid-sized businesses. It was aimed to support the economy, and you're entitled to it. Again, I really think this is probably the most important item in the whole day. Is don't forget that your lender will be reviewing your application for forgiveness. So the more you put together, the better. To those of you who may be in other states outside of the state of Florida, or if you would sort of like an extremely long list of laws, regulations, and assistance, primarily from a state and federal government, please email me directly, and I can send you a hyperlink to a very useful website that's been published by published by LexisNexis, that basically sort of provides a quick link to everything that sort of has been passed and by state and federal governments. And you may want to sort of peruse this and see if there's any other items, if you happen to live in the state of Georgia or New York or whatever, that there may be some laws that may affect you. I'd be also happy to guide you through any questions that you may have on that. Those of you who have not submitted or ever filed a grant, I would encourage you, especially on the telehealth side, or if you're involved in any treating COVID-19 patients, or if you're involved in any research. Again, there's a lot of grants out there available. We'd be happy to work with you to submit your grants. There are rolling deadlines for many different not-for-profit, federal government, non-governmental agencies, and those kind of things that have grants out there available. So there again, to reiterate, there's a lot of money available, and if you just take the time, we'd be happy to guide you through submitting applications or working through any items where you've filled out applications and you haven't received any money. Let me just check to see if there's any questions. That was sort of, I wasn't sure whether we were going to have any questions, so I kind of wanted to sort of keep it around 30 minutes and 35 minutes. See if anyone else. I don't see any coming in. Give it a couple more minutes. Well, I think we've all, no, just a couple of people saying hello, hello to everyone. Okay, well, thank you very much for attending. I appreciate the opportunity to talk to you all. Um, Again, this is an overview. There's a lot more details. I'd be happy to spend some time helping you out and hopefully maximizing your ability to get government support. Again, there's a lot of it out there. And if you know where to look, hopefully we can help your practice um, grow and thrive through these. So one came out, expenses. Pension administration expenses included. It's a good question. I have been told that they are not included. I have also been told that the expenses associated with the with your CPA or your bookkeeper putting that to get your independent bookkeeper putting together the paperwork are not included. To be honest, I have not seen a definitive regulation come out that says that they are excluded. So again, I would take the position, and I don't believe it's particularly aggressive, I would include pension administrative expenses. I would also include your CPA expenses, and I would leave it to the federal government or the employees to push back on that. I think there's probably going to be when folks start submitting their paperwork back to their financial institutions, I think there's going to be some pushback from a lot of members of Congress that they meant for this to be included and that to be included. So I would track it, include it, and if necessary, have it pulled out by a third party. Okay, well, that's about it. Thank you so much. I appreciate your time, and feel free to contact me directly. And stay safe.